and at moderate pace. We now take goodwill message from UK, United Kingdom.
Deputy Director for International Workforce at the UK Department of Health and Social Care. I'm sorry I can't be with you in person today, but it's a real pleasure to contribute to the second Africa Health Workforce Investment Forum. Thank you to our hosts, to the World Health Organization, and to all partners for bringing us together at such an important moment. This forum is about people, health workers who are the backbone of every health system, and whose skills, dedication, and leadership make universal health coverage and health security possible in practice. Since the first forum, there has been real progress. Countries have taken concrete steps to strengthen planning, expand training, create jobs, and address retention, turning shared principles into national action. That momentum deserves recognition, and it shows what can be achieved when evident political leadership and partnership come together. From the UK's perspective, we are proud of what we have achieved through our Global Health Workforce Programme, and we're proud to work alongside African governments and institutions like WHO Afro as long-term partners. Commitments to global health workforce partnerships is key to healthier populations, global economies, and greater resilience to future shocks. Global health remains a priority for the UK government, and we are committed to working in close collaboration and in partnership with countries, international partners, and institutions. Stated in our 10-year health plan, if we want to protect health in the UK, we will need to support global health security. The UK Department of Health and Social Care and the Foreign, Commonwealth and Development Office continue to work collaboratively to strengthen global health and the health workforce, tackle threats, and protect vulnerable communities. The theme of this forum, Plan, Train, Retain, captures exactly what is needed. Over the coming days, the focus will be on how we move faster and further from commitments to impact and from ambition to results on the ground. The UK remains deeply committed to working with you, and I wish you a productive and inspiring forum. Thank you.
Thank you. We'll now take 3 in-person messages from partners, key partners, and we are finally requesting all the speakers to observe the allocated speaking time, 3 minutes. We'll be hearing from Dr. Bill Mission from UNFPA, from Dr. Abudin of the CDC, Africa CDC, but we'll start with Nicole Delaney, Senior Fund Portfolio and Country Manager of our fund.
Your Excellency, Vice President of the Republic of Ghana, Professor Jane Nana Oku-Mejiman, distinguished ministers, excellencies, colleagues, partners and friends, good morning. It's a pleasure to be here at this forum, and I thank you for the opportunity to address you today on behalf of the Global Fund. Let me begin by congratulating the Government of Ghana, WHO Afro, member states and all partners on the convening of this second Africa Health Workforce Investment Forum. This forum comes at a critical time for the continent. Its theme, Africa's Health Workforce, from words to action, plan, train, retain, captures the urgency of the moment, the need to move from commitments to concrete and implementable actions with underpinning financing. The forum provides an important opportunity to accelerate implementation of the Africa Health Workforce Investment Charter, adopted at the first forum in Windhoek 2024, while catalyzing new commitments and stronger country-led investments in the health workforce. Together, these efforts provide a stronger evidence base, a clearer political platform, and a shared direction for the African continent to support Africa's health workforce challenges. The health workforce is the foundation of every health system. It is central to accelerating progress against HIV, TB, and malaria, strengthening primary health care, and building resilient systems for pandemic preparedness and responses. For the Global Fund, investing in the health workforce is central to our mission. Across funding cycles, Human Resources for Health has represented the largest share of our health and community systems investments, investing in financing for the African health workforce, in the remuneration of health workers, supporting community health workers, supporting pre-service education, recruitments, deployments, Human Resources for Health analytics, and investment planning. But financing alone is not enough. We must ensure that investments are evidence-based, aligned with national systems, and designed to support long-term sustainability. This is why the Global Fund is working with countries and partners to move from a fragmented or vertical workforce support towards integrating health workforce planning with a strong focus on primary healthcare and sustainable financing. We're supporting the community health workers, their integration into national health systems, and the underpinning HRH strategies and financing frameworks. The Africa Health Workforce Investment Charter provides an important instrument to align governments, partners, development banks, the private sector, and civil society around common national investment plans. Alignment essential to reduce duplication, improve efficiencies, mobilise additional resources, and ensure that investments respond to the real needs of countries and communities. As we look ahead, the Global Fund remains committed to supporting countries to implement the Charter, strengthen sustainable human resources for health investment planning, and align Global Fund resources with national strategies. Let me thank WHO Afro for its leadership, the Government of Ghana for hosting this event, and all governments and partners who have contributed to this important effort. The Global Fund is very proud to be part of this partnership and looks forward to working with all of you to move from words to action. I wish us all a very successful and productive forum. Thank you.
Thank you very much, Nicole Delaney, for the support from the Global Fund. We will now hear from the Director of Health and Humanitarian Affairs of the African Union Commission. Let's welcome Professor Julio Onirina.
Merci beaucoup, Monsieur le modérateur. Honorable Madame la vice-présidente du Ghana, Excellences, Mesdames et Messieurs, le protocole observé. Au nom de la Commission de l'Union africaine et en ma qualité de directeur de la santé et des affaires humanitaires auprès de la Commission, je tiens à exprimer ma gratitude pour avoir convoqué cette grande réunion. L'Afrique supporte près d'un quart du fardeau mondial des maladies, mais ne compte qu'une faible proportion de professionnels de santé. À l'Union africaine, au niveau continental, dans le cadre de l'agenda 2063, l'Afrique que nous voulons est guidée par des instruments tels que la stratégie de santé africaine et la feuille de route de l'Union africaine vers 2063, 2030 plutôt, et au-delà. Il est important de noter que l'Assemblée de nos chefs d'État et du gouvernement en 2017 franchit une mesure audacieuse en appelant au déploiement de 2 millions d'agents de santé communautaire à travers le continent. Cette décision reflète une reconnaissance claire de la prestation de services au niveau communautaire est fondamentale. À cet égard, la Commission de l'Union africaine élabore actuellement un cadre continental pour accélérer la mise en œuvre de cette initiative visant à soutenir les États membres les 55 États membres dans la normalisation de la formation, le renforcement de la supervision, l'assurance d'un financement durable et l'intégration des agents de santé communautaire dans le système de santé. Permettez-moi de souligner 3 priorités: transformer nos engagements et effectivement en relation avec le thème de cette réunion. Premièrement, nous devons renforcer la planification de ces agents communautaires de santé. Deuxièmement, nous devons, dans le cadre de la normalisation, augmenter la formation dans l'optique d'améliorer la qualité et la pertinence. Nous devons donc ainsi investir dans des programmes basés sur les compétences. Et troisièmement, la rétention reste l'un de nos plus grands défis. Excellence, mesdames et messieurs, la mise en œuvre de ces priorités nécessite une coordination renforcée, un financement extérieur soutenu et des partenariats innovants. La Commission de l'Union africaine que je représente ici est engagée à soutenir les États membres dans cette dynamique. Je vous remercie.
Merci beaucoup, Professor Rapitoni-Rina. See. We'll now take a little message from the Chief of the Sexual and Reproductive Health and Rights, UNFPA, Dr. Ayman Del Musen.
Your Excellency, Madam Vice President of Ghana, honorable delegates, distinguished guests, partners, colleagues, ladies and gentlemen, great protocols observed. It is a profound honor to be here today in Accra, a country that has long understood and appreciated that the nation's health is only as strong as its front line. We gather today at a defining moment where we collectively recognize the urgency to address the workforce challenges that underpin our health systems and forms the basis of the future of our African continent. This meeting comes just a day after the celebration of the International Day of Midwife. But standing here today, we must address the reality behind that celebration. Midwives are the very backbone of primary healthcare systems. The world today recognize the immense contribution of these midwives to make as a trusted members of communities. When trained and supported, they can provide 90% of essential and newborn health services. Yes, we are a million short, and our colleague from the African Regional Office discussed the shortages this morning, and they constitute only 10% of the workforce. Midwives are also critical frontline workers and providers in humanitarian contexts, providing life-saving services during and after a crisis strikes, during conflict, a natural disaster, or a climate shock. At UNFPA, we have a long history of working with honorable governments to train, equip, and support midwives across a wide variety of contexts. We have demonstrated the value of investing in midwives. Countries adopting midwifery models of care not only see the reductions in maternal and newborn mortality, stillbirth, they also see an improvement in the reduction of unintended pregnancies, making informed decisions about fertility choices, and improving the early detection and the prevention of multiple sexually transmitted infections, mother-to-child transmission of HIV, and other communicable and non-communicable diseases. There's a saving of around $9.3 to be garnered for every $1 investment. And in some cases, the return on investment can be as high as a 16-fold, as some studies have demonstrated. With 70% of global maternal deaths taking place in sub-Saharan Africa, our message is clear. An investment in midwives is an investment in mothers and newborns in Africa, and an investment in the future. As we define the Africa Health Workforce, the agenda for 2035, let us ensure that the African midwife is as professionalized, well-paid, fully equipped as a pillar of every African health budget. We look forward to these discussions over the next 3 days, and I would like to thank you for your attention.
Thank you, Dr. Abdel Mohsen from the UNFP. We'll take our last message, which will be by video. And the speaker is Assistant Director General Health Systems, and it's Dr. Yukiko Kapani.
Your Excellency, Honorable Ministers, distinguished colleagues, partners, and guests. I'm delighted to address the second Africa Health Workforce Investment Forum. I express sincere gratitude to His Excellency President John Dramani Mahama for Ghana's warm hospitality. And I thank the WHO Regional Director for Africa, Professor Mohamed Yacob Janabi, for his leadership in convening this important gathering. You are here to consider a crucial topic for Africa's future. Investment in the health workforce delivers a triple win across health outcomes, jobs and economic growth, and global health security. Realizing this investment requires integrated health workforce strategies, with ministers of health, finance, education, and labor all working together. I warmly welcome the adoption of the new Africa Health Workforce Agenda for the 2026-35 Plan, Train, and Retain. This provides a clear, actionable framework for member states and partners. It is tailored to Africa's context and ambitions. It addresses the full health workforce cycle. It builds on the Africa Health Workforce Investment Charter, which signaled investment in the health workforce as the foundation of the health systems. Together, we must align behind nationally owned investment strategies, and together, we can deliver measurable results. For example, I'm proud of our work with the ILO and OECD on the Working for Health program. This is supporting member states across the region to strengthen and sustain their workforce and keeping health workforce visible at the highest political levels. I commend you all on progress made and encourage you to build on momentum. The success of the forum will be what happens in the coming months and years. Investment plans designed, budgets committed, health workers hired, deployed, and retained, health systems that deliver quality care to all those who need it. WHO, across its 3 levels, stands ready to support. I thank you and I wish you a successful meeting.
Thank you very much to Dr. Nakatani, and thanks to all our speakers who gave us goodwill messages. Madam Vice President, distinguished guests, to take the future, we also reflect on the important milestones that have brought us here. We now take reflections from the inaugural Africa Health Workforce Investment Forum held in Windhoek in 2024, as well as the high-level ministerial session during the 74th Regional Committee. It's my pleasure to welcome the Honorable Minister of Health for the Central African Republic. Let's welcome Honorable Dr. Pierre Sumse.
Excellence, Madame Jane Nana Ekoko Agema, vice-présidente de la République du Ghana, honorable ministre, Excellence, distingués délégués, partenaires et collègues. Tout d'abord, Madame la Présidente, vice-présidente, permettez-moi d'adresser à Monsieur le Président et à vous-même, ainsi qu'à votre gouvernement, notre respect et notre chaleureuse félicitations pour le leadership extraordinaire que vous démontrez sur notre continent et dans le monde en matière de santé. Et également pour garder l'héritage de Kwame Nkrumah en matière de leadership et de l'indépendance de notre continent. J'ai donc l'honneur de partager mes réflexions sur la Charte africaine d'investissement dans les ressources humaines en santé, ainsi qu'un événement ministériel parallèle de haut niveau que j'ai organisé lors du 74e comité régional de l'OMS pour l'Afrique, intitulé « Passer des paroles aux actions, opérationnaliser la Charte africaine d'investissement dans les ressources humaines en santé ». J'ai initié cet événement parallèle pour aborder une question centrale. Comment l'Afrique pourrait traduire les engagements politiques en matière de ressources humaines en santé, en emploi, en compétences pertinentes et en résultats concrets pour fidéliser les ressources humaines en santé dans les zones rurales et défavorisées. Cet événement était un dialogue multisectoriel axé sur les solutions, basé sur la compréhension commune que les défis liés aux ressources humaines en santé ne pouvaient être traités seuls par les ministres de la Santé, mais nécessitaient
but we need coordinated action between the Ministry of Education, Finance Partners, and development agencies. Ministries, public services in our countries have to all come on board. And this is a practical effort which is necessary to align necessary investment in health workforce. This is needed to promote equity, health security, and to help us attain the objectives in Agenda 2063. With the support of all partners, we have to be able to meet our investment objectives. An analysis of the health workforce include activities that have been undertaken by various structures, and this shows the budgetary deficits that need to be met. Reports have been prepared to that effect. A national census on health workforce covering all the regions was undertaken with more than 120 agents that took part in this exercise. And this shows the imbalance between the rural and urban areas. This requires necessary reforms
sous l'impulsion du gouvernement et qui ont produit des résultats
and
tangibles,
we need to produce
notamment,
tangible
premièrement, le gouvernement a
results. First
supprimé
of all,
le numerus clausus dans les
the
établissements de formation
government
particuliers.
has undertaken
Cette
some
décision a
measures,
permis aux
and
écoles de
these
médecine et
measures
à d'autres
have
professionnels de santé
enabled
d'admettre des étudiants jusqu'à leur pleine capacité
institutions
de
to admit
formation,
more
levant
people.
ainsi une barrière
That
culturelle,
takes away
bloc qui avait fortement
institutional
limité
barriers
la production de
and
médecins,
to
d'infirmiers,
limit
sages-femmes, etc.
challenges.
Deuxièmement, en réponse aux défis, au déficit urgent de services de santé, en particulier dans les zones difficiles d'accès,
We
le
need
gouvernement
to
a approuvé la
bridge the
formation
gap
de 2000
in
personnels de
terms of
santé
access
d'ici
to
2026,
remote
avec un
areas.
accent particulier sur le déploiement dans les
We need
communautés
to
éloignées
focus
et
on
mal desservies.
deploying people to these
Troisièmement, les
areas, these
engagements pris
remote and
par les
rural
pays
areas.
à
Commitments
recruter
have been
2000
made
agents de santé
to
d'ici 2026
recruit
ont traduit un
2,000
engagement en
more
action
health
du ministère de la
workers
fonction
by
publique
the end of
et 850 postes
2026.
budgétaires et voire plus dans la fonction publique
In
au cours de l'année
and some of
économique,
these community agents
garantissant
have
que
to
les
also be
décisions
recruited
politiques
into the
sont
public
soutenues
service.
par des postes budgétisés.
All these have to be
Ces réformes ont
supported by
été
the budgets. The
renforcées par des
reforms have to
investissements
be
ciblés.
strengthened
Des
by
ressources importantes ont été
investment. Resources
mobilisées
have
pour
been
renforcer la
mobilized to build
capacité en
capacity
matière de
in terms
formation.
of
Plus de
training. More
500
than
millions de francs
500
CFA
million
sont environ
francs
900
CFA,
900 000
which is
dollars
equivalent of
américains, ont été investis dans la
900,000
construction et
US
la
dollars,
réhabilitation des
have
infrastructures de
been
formation, ainsi que le
invested
développement d'amphithéâtres,
to
en
support
particulier des centres de
these
santé.
measures.
Les investissements améliorés les
These
conditions
investments seek to
d'apprentissage,
improve
élargir la capacité
learning
du système
conditions
pour
and to
former
build
un plus grand
capacity
nombre de professionnels
of
de
a lot
santé.
more
Parallèlement,
health
des mesures
workers.
décisives ont été prises pour
Decisions
élargir
have
les
been and
opportunités
measures have been
d'emploi.
taken to
Bien qu'en 2025,
expand the
2250
scope.
nouveaux emplois ont été créés
New
pour les
employments
professionnels de santé qualifiés
have
grâce
been
à des efforts conjoints
created,
entre le gouvernement et des partenaires clés tels que la
and
Banque
these were
mondiale,
supported by key
le Fonds
partners such as
mondial
Global Fund,
agricole,
World Bank,
AHWIF et la
Gavi,
Fondation
and the
BAFA.
Buffer Foundation.
Cette
This
expansion a permis aux
expansion has
professionnels de
enabled
santé
health
a permis à des professionnels de santé d'être
professors
efficacement
within the
intégrés
health
au système de santé et déployés pour
space
renforcer
to be
les
equipped with the
prestations de services.
necessary skills in order to
Pour que les
dispense their
pays
functions.
réalisent
In order
des
for our
progrès
countries to
remarquables, ils doivent
attain
intégrer les
remarkable
principes de
progress,
la
we
charte.
need to integrate the principles in the charter.
Des progrès ont été également réalisés dans le
Successes have been chalked
recrutement des agents de
in
santé communautaire.
the recruitment
Notre
of
convention a
community
été
health
atteinte
workers.
avec le
We
recrutement
have reached
de
a great
8205 agents de santé
milestone
communautaire via des initiatives
through
d'engagement communautaire
these
soutenues par
initiatives,
des
supported by
partenaires tels que la
partners
Banque
like
mondiale, le Fonds mondial,
World Bank,
USAID et
Global
UNICEF.
Fund,
Cette
USAID,
expansion a
and
considérablement
UNICEF. This
étendu les
has
services de santé
expanded
de première ligne,
service
en particulier dans les zones mal desservies et les
to
zones éloignées.
areas, rural areas.
Ensemble, ces réformes reflètent de manière
These
la manière dont la République
reforms
centrafricaine a mis en œuvre
show the
et
commitment to the
constituent un exemple
charter
concret de la
and
manière dont
shows
nous avons
how
transformé les
we
données
have
en
been able
décisions
to
et les
translate
décisions
data
en actions
into
concrètes
decision.
pour les populations. Suite au lancement de
Following
la
the
charte de
launch
l'OMS
of
en
the charter,
2008, nous
WHO
avons soutenu
has
le
proven
pays
its
par le
commitments
biais
to
de
the
la production
countries
de données
through
probantes et
providing or by
d'analyses
providing
pertinentes.
data
Des dialogues sur les politiques
analysis
d'investissement et
service to
d'environnement.
these countries.
L'assistance
Technical
technique pour des plans
assistance
stratégiques
has
budgétisés,
been
des plans
provided,
d'investissement et des pactes. L'orientation stratégique pour la mise en œuvre de la charte.
to enable
Votre
the
Excellence,
countries to implement the
Mesdames et
principles in
Messieurs,
the
distingués
charter.
invités,
Excellency,
il est
ladies
plus
and
que jamais
gentlemen,
important
dear
d'investir durablement dans les
invited
ressources humaines
guests, now more
pour que
than
les
ever,
pays réalisent des progrès
it
remarquables.
behoves us
Ils
to
doivent intégrer les
invest
principes de
in
la
the
charte
health
dans les
workforce
stratégies
and seek
nationales de
to
développement,
implement the
les
principles
processus
in the
budgétaires et les réformes de la
charter.
fonction publique. De même, le leadership présidentiel
Leadership,
doit réunir les secteurs clés de
executive
l'espace
leadership
budgétaire
is
et
needed
maintenir le
to
système de
maintain
répartition.
these successes.
Je voudrais
I'd
également
like to
ajouter, comme vous
add,
l'avez déjà
like I've
souligné
said
tantôt,
earlier,
les
that
premiers travailleurs de santé sont la
the
population.
first
Ce sont
responders
les
in terms of
individus
health are the
vulnérables.
people.
On le voit bien dans les
We see
épidémies.
that
Si
in
les épidémies ne sont
epidemiology.
pas, que vu que les
If
populations dans l'intimité de
the
leur vie ne sont pas
outbreaks are
notifiées
not
par celles-ci à
reported
temps,
on time by
donc
the
nous perdons le contrôle de
community, we
l'épidémie.
lose control.
Tout en
And so we
faisant
need
des
to
efforts sur
focus
la
our
formation du
efforts
personnel
by training the community and not only the personnel, bearing in mind that the first responders are the people if they are able to take their destinies in their own hands. To conclude, Excellency, Madam Vice President, the work ahead is not only to agree on what to do, but to act decisively to ensure sustained results, to ensure that investment in health workforce will contribute to creating jobs and developing our human resource. Of course, we need to go beyond the national context, and this is why we have gathered here at this continental meeting. We have to take this conversation on health workforce to the continental level and come up with a real framework, a real roadmap, and for the continent. I thank you.
Merci beaucoup, Monsieur. Thank you very much. Thank you very much. Yes, from Central African Republic for those reflections. Madam Vice President, Excellencies, ladies and gentlemen, Africa has made notable progress in health, workforce, education, and investments. Yet major challenges remain, including shortages, migration pressures, and workforce inequities. Next to speak, it's my honor to invite Professor Mohamed Yaqub Janabi, WHO Regional Director for Africa, to speak on the state of health workforce in Africa, turning our commitments into actions. Plan, train, retain. Professor Janabi, please.
Brother Medasepi Ghana. Your Excellency, Professor Jane Opoku Ajiman, Vice President of the Republic of Ghana, honorable ministers led by our host, Minister Kobena Minta Apando, distinguished colleagues, partners, and friends. Your Excellency, let me begin not with policy, but as Minister Sose said here, with people. Ama, in Nima, Tamale, and Wa, saves every morning with dignity, yet without the certainty of a salary. Kwame, who once cared for thousands across Kumasi, Cape Coast, and Sunyani, a patriot, a healer, today saves another country outside the continent. Efua, midwife in Tema, Takoradi, and Ho, has welcomed thousands and thousands of African children into this world. But she will tell you, one gap in training, one missing support can cost a life. This is not a shortage of effort. This is not a shortage of talent. This is a system under strain. Your Excellency, Madam Vice President, allow me to speak not as a regional director as I was introduced, but as a cardiologist. I'm a heart specialist. I remember a young patient lying on the operating table, heart open, time slipping away. We had the science there, the skill was there, but the team was incomplete. And in that moment, one question stayed with me to date. How can a continent that trains such talent struggle to keep it where it is needed most? That questions bring us here to Accra today. Because in 2024 in Namibia Windhoek, we made a promise. Plan better, train more, and retain longer. Today in Accra, we are not here to repeat that promise. We are here to deliver it. And we do so in a changing world which faces us today. a world of tightening financing, shifting geopoliticals, and a rising global competition for health workers. Today, health workers are not just caregivers. They are strategic assets. Africa has responded. We have expanded our training. Your Excellency, from 2022 to 2024, the continent trained 500,000 health workers. We are producing a talent at scale, but the truth is very uncomfortable. 1 in 10 of our trained professionals have already left to the northern globe. 4 in 10 are preparing to leave the continent. Your Excellency, some of them are looking at you there on the floor. Maybe the next meeting we are not going to see them. But let me be clear and let me be fair. Africa is not against mobility. Africa is not against people moving. Our professions have the right to grow, to move, and to thrive. But mobility must be fair. Because today, some of the world's strongest health systems in Europe, in North America, some of the East Asian countries depend heavily on African trained profession. This has created value, but the next step must create the balance. Madam Vice President, this is not a criticism. It is an invitation to move from recruitment to partnership, from benefit to shared responsibilities. This is the essence of the Accra reset. A reset that says no extraction without co-investment, no advantage without accountability, and no global health security without a shared responsibility. If Africa trends, the world must help to sustain it. If Africa gives, the world must give back. And if Africa loses, the world must help rebuild it. Because unmanaged recruitment we see today does more than move people. It moves our mentors, it moves our lecturers, it moves our professors, it moves our teachers, it moves our future generation. It weakens already a fragile system, and it deepens the global inequities we cannot afford. And yet, Africa's strength remains unshaken. At the forefront, in the communities, in the primary health care, where we have 1.1 million community health workers standing between vulnerability and survival. They are not statistics. They are Africa's shield. Excellencies, Africa must also act. We must create jobs, not graduates. We have a Minister of Education here. We must retain talent, not just train it. And we must call our diaspora home, even only for a season, to teach, to mentor, to transfer skills. And this call I have carried from Accra to London and beyond. Today we launch 2 instruments of transformation: the State of Health Workforce in Africa 2026 and the African Workforce Agenda 2026-2035. But let me say this clearly. Documents have never saved lives. Actions have done. As Kwame Nkrumah reminded us, the forces that unite us are greater than those which divide us. I hear Ghanaians responding. He was right. Ghana now stands at the moment of continental leadership. With the African Union ahead of you, the world is listening to you. This dialogue can begin here. This partnership can begin here. The reset can begin here today.
WHO Afro stands ready to walk this path with you and anyone with a goodwill for our mother Africa. So let us choose courage over comfort, partnership over silence, and action over delay. Madam, let me finish by giving you an example, and our partners are here. Our recent document from WHO estimates placed the average cost of training one doctor for 6 years in Africa region at $17,351, and for the nursing for 3 years at $10,172. That 2024 year, we had 4,000 doctors in UK, 4,000 nursing in NHS alone, meaning that year we lost $110 million. Madam, this might indirectly translate some poor health indicators we observe in our continent. We have many other factors, but I'll give you an example of that 2024. In some of West African countries, the death maternal mortality ratio was at 1,000 per every 100,000 deliveries, live deliveries. In the UK, it was 8 per 100,000 deliveries. And I do repeat, we have other factors which might have contributed, but lack of experts is one of them. At Afro, we are looking to continue our dialogue with our friends in the Northern Globe to have a transparent, mutual beneficial government-to-government partnership. Why not establish a co-investment, which we discussed in the morning mechanism, that tied recruitment gains and save training costs? Let me put for you in perspective. Last year, 2025, UK saved 1.1 billion sterling pounds from training. They didn't train, but they recruited. So all what we are asking from our partners, which will continue and WHO will guide it, let's sit down and discuss. Do a government to government, whether it's memorandum of understanding. You come to Ghana, for example, or you go to Nigeria. How many medical staffs do you need? We give you the medical staff. You give us percentage, whatever, which is going to be agreed with member states, so we can continue to train. I'll finish you with an example which we did in Zimbabwe. Zimbabwe is here. We got some money, $426 million. Invested it. Let's see what will happen. They improved the infrastructure. They improved the allowances. Your Excellency, let me report. Attrition was less by 61%. Meaning, if we improve and everything, we can move forward. Because in the end, he who has health has hope, and he who has hope has everything. Yeda Moase Medase Pil. Thank you.
Professor Janabi, yes, the tree is great. Thank you so much for rich remarks and those startling figures, but there's hope. Thank you. I invite the Honorable Minister for the Republic of Ghana to deliver his remarks. Let's welcome Honorable Pabna Minta Indo, MP. Yes. Take a seat.
Thank you very much, my brother Kafui, for the opportunity. Your Excellency, the Vice President of the Republic of Ghana, Professor Nana Akufo-Addo, my colleagues, honorable ministers and deputy ministers of health, public service, labor, education, and finance from across Africa, the WHO Regional Director for Africa, Professor Janabi, the Director General of Africa CDC, I have not seen here yet, if he has a representative here, representative of the Africa Union Commission, members of the diplomatic corps, development partners, senior government officials, leaders of health professional association and health worker unions. I've seen some of the union leaders here, distinguished delegates, friends and colleagues, ladies and gentlemen, good morning. It is an immense privilege and honor to welcome you to Accra for the Second African Health Workforce Investment Forum, convened under the theme Africa's Health Workforce from West to Action, Plan, Train, Retain. On behalf of the government and people of Ghana, I extend to you all a warm welcome to our country. And in Ghana, we say Akwaba. Ghana is deeply honored to receive the baton from the Republic of Namibia, which hosted the inaugural forum in Windhoek in May 2024. The gathering marked a defining moment in Africa's collective approach to health workforce investment. It was in Windhoek that Africa Health Workforce Investment Charter was launched, and member states adopted the Windhoek Statement on investing in Africa's health workforce. Together, these instruments help change the conversation by making it clear that investment in health workforce is not a narrow sectorial concern. It is a foundation for universal health coverage, health security, economic development, job creation, gender equity, and the resilience of our continent. Just as importantly, the Charter reminded us that the health workforce investment is not merely about increasing numbers. It is about fairness, quality, distribution, competence, motivation, mobility, retention, and dignity. It's about ensuring that every community, including rural and underserved communities, can count on skilled, motivated, and supported health workers. It is in this sense that Accra Forum must be seen not simply as a continuation of Windhoek, but as a moment of implementation. This is a call to move from declaration to delivery, from plans to investment, and from commitment to measurable results. Your Excellency, Ghana has a special connection to this agenda. Before the Charter was adopted in Windhoek, part of its foundation was shaped here in Accra. In November 2022, Ghana hosted the Regional Policy Dialogue, helped build consensus among member states and partners on the need for an African Health Workforce Investments Charter. For us, therefore, the forum is not merely another international meeting hosted in Ghana. It is a continuation of a continental conversation with which Ghana has contributed from the early stages. The history also places a responsibility on us to demonstrate how the principles of the Charter can be translated into national action. This effort is strongly aligned with the Accra Research Agenda championed by His Excellency the President of the Republic of Ghana, President John Dramani Mahama, which calls on us to rethink public institutions, improve accountability, strengthen domestic capacity, and build systems that serve people with dignity. In the health sector, this broader national reset is expressed through our commitment to African health sovereignty. By health sovereignty, we do not mean isolations. We mean the ability of our countries to define our priorities, use of our own evidence, mobilize sustainable financing, train and retain the health workers we need, and organize the services around the realities of our people. This is also the heart of the health workforce investment agenda, because no country can build a resilient health system if it cannot plan, train, deploy, and retain the people who make the system work. For Ghana, therefore, the workforce agenda is not abstract. It sits at the center of our current health sector priorities. It is central to the successful rollout of the free primary health care, which seeks to remove financial barriers at the point of primary care, while strengthening prevention, health promotion, early detection, and continuity of care. It's also central to the Ghana Medical Trust Fund, popularly known as Mahama Cares, which has been established to support care for non-communicable diseases and specialized services that have historically placed heavy financial burdens on households. These priorities may differ in design, but they are connected by common requirements. They all depend on capable, motivated, well-distributed health workforce. Free primary health care requires competent frontline workers at CHIPS compound, health centers, polyclinics, and district hospitals. Mahama Cares requires specialist capacity, multidisciplinary teams, stronger referral system, and a reliable pipeline of skilled professionals for NCD's care, dialysis, oncology, cardiovascular services, and other complex conditions. Hospital retooling, expanded diagnosis, and 24-hour services in public hospitals also require a workforce that is properly planned, properly trained, fairly deployed, and adequately retained. Ladies and gentlemen, to make this connection between policy ambition and workforce capacity meaningful, Ghana has placed increasing emphasis on evidence-based planning, and in 2023, Ghana conducted a comprehensive health labor market analysis. This exercise gave us a clear picture of the health workforce pipeline from education and training through employment and deployment to retention, mobility, and service needs. The value of the analysis was not only the data it produced, but in the policy questions it enabled us to confront. How many health workers do we need? Where are they needed most? What competencies are required for primary health care, emergency preparedness, specialist services, chronic diseases and management, health security? How do we address unemployment among trained health professionals while some communities remain underserved? And how do we structure workforce exchange programs in a way that protects national needs whilst creating ethical and mutually beneficial opportunities for our young professionals? Building on these questions, I convened a national policy dialogue on Ghana's health workforce in 2025 to build consensus around the findings and define the policy choices required. The dialogue focused on strategic roles, optimization of the health labor market, and sustainable investment in human resources for health. It also reaffirmed that although Ghana has made progress over the past decades, challenges remain in deployment, retention, equitable distribution, and long-term sustainability. Out of that consensus, a number of important reforms are being advanced. First, the Ministry of Health, working with partners, is advancing structured workforce exchange program. These programs are intended to promote ethical, regular, and mutually beneficial labor mobility, protect the needs of Ghana's health system, and create organized opportunities for young Ghanaian health professionals to gain international experience, enhance their skills, and return value to the domestic health system. Second, we have used the health labor market analysis to develop a draft national health workforce development plan. This plan positions health workforce investment as a national development priority and not merely as health sector staffing matter. For that reason, we are working closely with the Ministry of Finance, the National Development Planning Commission, and other stakeholders to integrate the plan into Ghana's medium-term development agenda. While these planning processes are important, health needs are immediate and cannot wait for perfect conditions. We have therefore begun implementing key elements of the national consensus even as the broader investment plan is being finalized. The Ministry of Health has introduced measures to improve the deployment and distribution of health workers to underserved regions and communities, while strengthening the use of evidence to guide postings, staffing norms, and service delivery priorities. This same logic is guiding our approach to health workforce education. To optimize training, the ministry is engaging the Ministry of Education, regulatory bodies, training institutions, and other stakeholders to develop a national health workforce education master plan. This will guide medium to long-term investment in the health professional education across both public and private sector. Our objective is not merely to train more health workers, it is to train the right health workers with the right competencies in the right numbers and for the right places. Your Excellency, Ghana's experience reflects a wider continental reality. Across the WHO Africa region, the density of doctors, nurses, and midwives increased from 11% to 10,000 population in 2013 to 22 per 10,000 population in 2022. Ghana has among these countries reported to have made significant progress towards the SDG-related threshold of 44.5 doctors, nurses, and midwives per 10,000 population by 2022. These gains are important, but they are not sufficient. National and regional averages can hide persistent inequalities. Some districts and communities still struggle to attract and retain skilled health workers. Some trained professionals remain unemployed or underemployed, while service needs remain high. Mobility pressures continue to affect critical cadres. The transition from training to employment also requires stronger alignment with physical space, service priorities, and the realities of population. It is precisely because of these unresolved challenges that the theme of this forum is both timely and urgent. Moving from words to action means that Africa must convert these health workforce strategies into financial investment plan into budget commitment, and budget commitment into jobs, training reforms, deployment systems, retention package. Ultimately, all of these must be felt by our people as better access, better quality, and better health outcomes. For Ghana, this means ensuring that workforce investment support the full continuum of care. At the primary level, health workers must be equipped to promote health, prevent diseases, detect conditions early, and manage common illness close to where people live. At the secondary and tertiary levels, we must build and retain the specialist skills required for complex care, including NCDs, emergency care, surgery, diagnostics, rehabilitation, and enhanced ethical services. Across all levels, we must improve management, supervision, motivation, and working conditions so that health workers do not only enter the system, but remain in the system with dignity and purpose. The work ahead requires political leadership. The political leadership alone will not be enough. It requires multi-sectorial collaboration and the active engagement of ministries of finance, education, labor, public service, and planning. It requires professional councils, training institutions, health worker associations, unions, private sector, development partners to align behind country priorities. Far too long, Africa described the health workforce crisis with clarity. We have documented the gaps, held the consultations, and adopted the declarations. The task now is to act with the same clarity with which we have spoken. That is why the outcomes of this forum must be practical, measurable, and implementable. Ghana stands ready to work with all member states, the World Health Organization, Africa CDC, the African Union Commission, development partners, and all stakeholders to ensure that the Accra Forum becomes remembered not only for the quality of its discussions, but for the seriousness of the actions it inspires. Let this forum send a clear message. Africa's health workforce agenda must no longer remain at the level of aspiration. It must become a financial, implemented, accountable continental priority. On behalf of the Ministry of Health and the government of Ghana, I once again welcome you to Accra. I wish you productive deliberations and a successful forum. Most grateful.
Thank you very much. Performance from the Ghana Dance Ensemble National Theatre. In case you're wondering, that's a Wongo dance. It's a harvest dance. And we thank God that the soil is, the ground is really solid, because that is quite energetic. With the performance, it's also go to the gym. I mean, it's a full workout. Distinguished guests, ladies and gentlemen, it gives me great pleasure to welcome the Honorable Minister of Education to introduce our keynote speaker. Please welcome the Honorable Haruna Idrisu, MP. This one is a pleasant surprise. Excellency, the Vice President of the Republic of Ghana, Professor Jane Nana Opoku-Agyeman. Excellencies, representative of the WHO. Excellencies, distinguished delegates and participants. The host Minister for Health, Minister for Labor, and very distinguished ladies and gentlemen. My task this morning is a very simple one. It's to introduce to you our special guest of honor for this important and auspicious ceremony to speak to the future of health and education and the future of the quality of our health workforce, their availability, their distribution, and their retention. No person other than her. She's been Vice Chancellor of one of our prime universities. And for those of you who are foreign guests, at independence, we only could boast of one university or two offering medical education, the University of Ghana and subsequently the Kwame Nkrumah University of Science and Technology. Under her leadership and the leadership of the NDC government, we now have more than 5 public universities providing training in medical education, including UHAS and her own University of Campus. I'm happy to note that under her leadership today, Ghana trains annually 55,000 nurses, and Ghana trains annually 1,000 to 200 doctors annually. Our doctor-to-patient ratio is 1 to 6, but in some deprived areas, 1 to 22. A determination our Vice President has to close the gap. The Vice President of the Republic, we celebrate her as our first female ever Vice President of the Republic of Ghana. She is supporting Excellency John Dramani Mahama, the President of the Republic of Ghana, in his research. And that research, the forum of the wealth of our health workers. Madam Vice President, I know that on May Day, you supported the President to observe Workers' Day. And to distinguished participants, this is what I want to identify Excellency with before I ask her to assume the podium. One of the workers dancing on May Day had a very good placard which read, "A happy, healthy worker leads to a productive nation." This is the nation our Vice President desires in supporting President Mahama to lead. She recently chaired on behalf of President Mahama as chair of an interministerial coordinating committee on decentralization, which blueprints would soon be adopted by NET. President Mahama is further positioning her to chair an interministerial committee on empowering, ensuring the fair distribution of workers, not just health workers. I have the honor and privilege to introduce to you Ghana's first ever female Vice President. Her words are few, but impactful. Madam Vice President, the podium is yours. Thank you. This is about
Thank you very much, Haruna. Please take your seats. I'd like to address everybody in this room as colleagues and friends. Is that okay? So you can consider yourself as a colleague and a friend. And if you don't like it, just consider yourself as individually addressed. Good afternoon. Yeah, I think it's good afternoon. On behalf of His Excellency, President John Dramani Mahama, I warmly welcome all of you to Accra. And Haruna, thank you for the kind introduction. What we have before us today urges us to move to decisive implementation. I've listened to the presentations made by speakers before me, and I've noted the anguish, the sense of urgency, and the genuine concern about what we can do and should be doing. I wanted to add one more to the questions that have been posed by speakers before me. And mine is, I think, a simple one. What makes it so easy for us to use scarce resources to train? And what makes it so difficult for us to retain the people we have trained? I want to add this or propose this as one of the themes at some point that we can discuss. There's something that is not working, and we all know it. We should identify it, face it, work at it. Yes, we must plan, train, and deploy health workers effectively, employ them sustainably, and retain them with dignity. We know how much our health determines our productivity, human capital development, economic resilience, and national security. It is central to the aspirations of the African Union Agenda 2063, and indeed to the SDGs and to our own prosperity. Over the last 2 decades, life expectancy in the WHO African region has risen significantly. Service coverage has also improved steadily. This has been supported by expanded immunization, stronger disease control, maternal and child health interventions, and strengthening health systems. Yet, while progress has been real, universal health coverage remains beyond the reach of billions of Africans. And distance, cost, and access remain real challenges. This is why the Accra Reset Agenda remains so important. It calls for rethinking institutions, policies, and investments to restore confidence in public systems, boost national development, and place citizens to the center of governance. In health, this means building resilient, efficient, equitable, and accountable systems and true African health sovereignty. Sovereignty in health refers to our capacity to define our own health priorities, mobilize sustainable domestic financing, train health workers we need, retain our talent, strengthen our institutions, and organize services around our own defined realities. It is not isolation, but partnership grounded in dignity. Cooperation with others must align with our stated concerns. Ladies and gentlemen, Ghana is determined to take concrete steps. 2 weeks ago, His Excellency the President launched Ghana's free primary health care. This initiative aims to expand access to essential services for persons residing in Ghana, regardless of their insurance status at the point of first contact. It is designed to ensure that common illnesses are treated early, preventive services are strengthened, and unnecessary financial barriers are mitigated. For the health system to work better, a large share of our population health needs can and should be effectively addressed at the primary care level. Last year, the President also launched the Ghana Medical Trust Fund, popularly known as Mahama Cares, to support our citizens living with chronic and expensive illnesses. The fund is already supporting investments in treatment capacity, equipment, specialist care, and the training of highly skilled personnel. So we need to find ways to retain them here. Distinguished guests, such policy must be felt by the citizens. At the same time, it cannot succeed without the healthcare workforce. Indeed, the foundation of our health sovereignty is the strength and competence of the health workforce. And that includes the doctors, the nurses, midwives, pharmacists, laboratory personnel, community health workers, specialists, service delivery professionals, and many others. And this is the time I commend the dancer who said that it's not easy to be a woman. But he forgot to tell us that women are also primary health care providers, aren't we? So we should clap for the women anyway. And yes, it's not easy, but we intend to make it work. And that is why the government has placed a high priority on the training those that countries can implement efficiently and sustain over time. And I wish all of you to leave Accra resolved to turn evidence into policy, then into investment, and finally, into measurable positive change. My hope for this is to become a turning point where our approach to health is defined by better planning, purposeful training, sustainable job creation, and the retention of talent with dignity. The message from Accra is straightforward. Investing in the health workforce is an investment in all of us. And investing in our people is definitely the surest way to securing our own prosperity and advancing the vision set out in Agenda 2063, which is the Africa we want. On this note, I'm pleased to declare the second Africa Health Workforce Investment Forum duly open. I thank you for your kind attention.
Thank you very much, Madam Vice President, for your keynote address. I'd like to now respectfully call on Mr. Onyango to present the documents that will be launched, the Africa Health Workforce Agenda 2035 and the State of Health Workforce in Africa Report 2026. Dr. Onyango is bring the documents, and I'll respectfully call on Madam Vice President and Professor Mohammed Janabi, from the Region of Africa, to launch the documents. Yes.
So, Your Excellency, the Vice President of the Republic of Ghana, honorable ministers, distinguished colleagues and friends, it is both a privilege and a profound responsibility to stand before you again as we launch the State of Health Workforce in Africa 2026 report and pre-launch the African Health Workforce Agenda 2026-2035. Because, as I said earlier, let us remember, behind every number is a life. So today we do not only present evidence, we present a decision to move from data to action, commitment to delivery, and from ambition to impact. So let us take this step together with courage, urgency, and hope. Your Excellency, it is now my great honor to invite you to lead us in this officially launching this report and unveiling Africa's path forward.
As the launch of the Africa Health Workforce Agenda 2035, and then the State of Health Workforce in Africa Report 2026. And all members on the dais will all receive a copy of the reports that are launched. Yes. Everyone. Now stand to display the reports that will be launched. Please take them out of the folders. We have two reports inside the folders. Yes. Take them out of the jackets so we can see both reports. And you shall see this picture in the press tomorrow. And on the internet now. Thank you. Can you put the post down and take a nice big photo after having launched the report? And while you're standing, remember this very brief. We'll have our ministers, directors general, and permanent secretary to join the platform to take this photo. Ministers, directors general, and permanent secretaries, please join the vice president and the members on the dais to take commemorative photo. All ministers, directors general, and permanent secretaries, this is your moment, please. My photographers, can some step down? Yeah, okay. So, yeah, some can step down.
Could you notice
The space at the bottom. And after this one, the ministers, directors general, and permanent secretaries will retire to their seats. And I'll call on all heads of my agency to replace ministers, directors general, and permanent secretaries after they've taken their photo. Big Miles. Thank you very much. Our VIPs will stay. Minister, Director General, and Permanent Secretaries, please retire to your seats. We call all heads of partner agencies. This is the final setting. All heads of partner agencies, please join the VIPs on the days for the setting. Others to join. I've asked to take only two. It's asked to take only two photos. Oh, yes. Heads of partner agencies, please. And thank you so much. Thank you very much. What announcement? Okay. All right, and this announcement, there'll be a media briefing downstairs when the opening ceremony ends in a couple of seconds. So there's a media briefing downstairs. Yes. At 1 p.m. Thank you very much. Okay, thanks. We finally, let's rise for the national anthem for Quebec, Ghana. Madam Vice President, distinguished guests, this concludes the formal opening ceremony of the second Africa Health Workforce Investment Forum 2026. Thank you very much for being part of this important continental commitment. Together, may we move from words to action. Madam Vice President, thank you for your time. She will now make her way out of this hall. Louis remain at post until she departs, and then we can leave. Madam President, Madam Vice President, exchanging presence. In case you're wondering why she's moving on to the very far, and in Ghana we greet from the right to the left. It's our culture. We greet from the right to the left, so she's greeting participants from the right all the way through to the left. Thank you. We'll take a half break after she departs for 15 minutes, and we continue with the remainder of today's program. Thank you, Madam Vice President, for your time. We'll take a break and we'll return in 15 minutes to continue today's proceedings. It's my pleasure to have your Director of Ceremonies. My name is Kafui Day. Bonjour. Have a good day. God bless.